So about more than 10 years ago, I was asked by one of the breast surgeons to help her with a patient who had family history of breast cancer and wanted a mastectomy, but didn't want female breast reconstruction, wanted male chest reconstruction because they were transgender. They'd been on hormones for about 10 years and they requested a consult. And at the time I hadn't done any of this kind of surgery. And so I embarked on it with a little trepidation as the patient asked me, how many of these surgeries had you done? And I said, none. And then after multiple consults until the patient felt comfortable and I felt comfortable, I did the surgery to contour the chest so that it looked masculine, which included resizing the nipple and the areola, putting it in a different location, and putting the incisions in a place that was sort of hidden. And they were so happy and they were so different after the procedure. They felt, they described it as relief. They felt relief, even in the recovery room, that it was then something I became interested in doing more of. I didn't know much about it, and so I educated myself and read as much as I could, and then I began doing more and more of these surgeries, both for transgender women and transgender men, to either remove the breasts and do male chest wall contouring or enhance the breasts. And they've been very gratifying procedures for me and for the patients. I haven't counted, but hundreds and hundreds. And now I would say it's about a third of my practice. So it's become a very, very important part of my practice. Who is a candidate for top surgery? So basically, somebody who has the diagnosis of gender dysphoria and has been seen by a psychologist or psychologist and has a letter to that effect. You do not have to be on hormonal therapy. Sometimes for insurance purposes, it's helpful in terms of getting the surgery covered. And to basically be a person who is in good physical health and good mental health. Any surgery is stressful, and so it's really important to be at your best physically and emotionally to get the best possible result. What are the most common side effects or things that might not go well when getting that surgery? So I think for females who are transitioning to male, the most common problems are numbness on the nipple and the areola and scarring. And unfortunately, there's no way to do this surgery without creating some sort of scars. And sometimes the scars can be great and almost invisible, and sometimes they can be quite visible and quite noticeable. So I think those are the two biggest issues, and hopefully over time we will improve techniques so that those can become better and better. Definitely. Scar management is now a really important part of my practice, and all my patients do some element of scar management. The other thing that can be done is a scar revision. And if the scars are unsightly, then I often do that. The other thing, which I don't do, but many of my patients do on their own, is they get tattoos to cover over the scars. And that looks great. And the tattoos do take on the scar tissue. And a lot of patients plan for that before they even have the surgery.